All right, let's move to the last presenter of this session, and it's Dr.Pei Chih Wu from the Department of Occupational Safety and Health, Beijing University. And her title is Climate Variability and Change and Their Potential Health Effects in Taiwan.
Before dealing with my slides, I have to admit that before my talk that in these days I feel a little bit frustrated because I have focused on this issue for a couple of years, but it's still difficult for me to understand those models and those terminology and technologies. I'm Pei Chih Wu. I was trained from the medical technology and also public health, environmental epidemiology. Before I focus on this issue, usually I deal with samples in hundreds and thousands, and compared to those huge databases in this range, my data is quite very small, actually. Instead of showing our ongoing, I just joined the TCCIP platform from this year, and instead of showing our ongoing works, I choose two case studies from my previous work in a couple of years ago. And the first two case studies, the island-wide two case study, one is for the vector-borne disease. One is for vector-borne disease patterns, and the other one is temperature extreme-associated death in Taiwan. And I show these two cases because this is the first trial I use island-wide database to see if the weather variability or climate will do impact on our public health sectors. And this work is collaborated with Professor Su in National Chongqing University and Professor Long and Lin from Academia Sinica, and also the NCDR Chen and Dr. Chen and Lin. And when we talk about the potential health outcomes associated with climate variability and change, we can classify the health impact according to the mechanism. The direct physical consequence caused by a direct change is usually the temperature extreme or the extreme weather event like a flooding, a heavy rainfall caused by injury or health loss. And also physical chemical consequence like the change of weather and interaction of air pollution to cause the changes of air pollution composition or the level of air pollution, and cause the increase of burden on air pollution related health effects like cardiovascular disease or other respiratory disease. And the other part is the physical biological consequence, which is the I'm trained on this part, so I'm interested at this most at this part. The weather pattern will change production of the flower growing season and the production of pollens and the composition of pollen and also fungal spore, and which will cause the burdens of population health on allergic illness. And also some infectious disease, because those weather parameter will changes on the contamination pathway or transmission dynamic, and they will cause the changes on water and foodborne disease and also vector-borne disease, which I will introduce a case study in Taiwan is dengue fever transmission. If we want to see the climate change, the impact of climate change on health effects, you will see we need weather data, we need those indirect effects. We will also need those data on mechanism like environmental factors, other environmental monitoring factors, and also health registration database. So I try to integrate 3 databases, and some of them, like allergist illness, I established an aero allergen station in Taiwan, and I have a record for 10 years, and I try to see if there's a correlation with climate. And also, today I will also show another cases in temperature extreme, like under cold event and heat events, and its impact on the mortality of heart attack. Okay, many infectious disease will affect by climate. This table shows some example of the disease and their code in our disease notification system. And many are those disease, infectious disease are food and waterborne disease, vector-borne disease, and flood-related disease. And also very important information is every disease have their incubation periods, meaning that the onset of illness before you got infection. And during this period, it's also the most easily for transmission. So this information is very important for us to understand every disease. And also, this information is also important for us to establish the relationship, establish the model. Like in dengue fever, in my models, the monthly data is okay to predict the disease occurrence. But for many waterborne disease, we probably need weekly data or daily data. We can have the better prediction model. Compared to the most disease in Taiwan, dengue fever is the most predominant. They have the highest case number. And I have some I have some data on shigellosis and drought problem in Taiwan. And today I will show you the dengue fevers and the associated weather parameters. When we talk about trying to see the climate patterns on infectious disease, this is why I'm thinking what I can do is from 2 aspects. The first aspect is long-term pattern. We can try to see, try to establish some time series analysis. If we got enough database for disease, we can have time series analysis, try to understand the weather pattern on the size of epidemic, meaning the frequency occurrence of disease in endemic area. In some certain area have the disease quite often. And we can also see the weather distribution pattern is associated with the geographic distribution of those diseases, and we can use spatial regression model. And for those infection disease, for many diseases, environmental factors, demographic factors, and also population susceptibility also affect a lot in the disease occurrence. So in every model, when I try to link the relationship, I will take into account the socio-economic factors and some environmental factors into the spatial regression model. And in the other aspect, we can also analyze the effect of extreme weather. After the event, we can predict, we can try to estimate the risk, the increase of the cases will after some different kinds of extreme weather, or we can identify the outbreak of disease by temporal spatial cluster analysis to see the extreme event in certain area or in certain time is that associated with the disease outbreak. That's what I usually do. In my cases, the first case is dengue fever. I try to establish a time series model in an epidemic area, and then I try to understand the climate patterns and other factors is that associated with the regional distribution of dengue fever. I wish I can establish the application is establish the early warning system by integrating weather parameter to predict the occurrence of disease in epidemic area or identify the determinants for the regional availability for policy or action plan for CDC. And before I'm working on this study, I will introduce this. We have the very good disease surveillance of infectious disease notification. Start from 1988 for dengue fever, but at that time, 1888 to 89 is paper record and monthly and county level, and so it's the transition of our data. So in this case, we try to find out all the paper record and try to reconstruct the time series of the cases. And also, we try to integrate the social demographic and socio-economic factors based on 2000 years demographic census. Dengue fever is regarded one of the world's most widespread vector-borne disease. It has 4 serotypes caused by fever virus. The same virus causes yellow fever disease. Yes, also the fever virus. And the major transmission factors in Taiwan is Aedes aegypti and also Aedes albopictus in Taiwan. 埃及斑纹跟白线斑纹。The incubation period usually 1 week. And especially for the endemic area, Taiwan, southern Taiwan is an endemic area, and majorly those disease also majorly happen in urban area. And the most dominant the vector, according to the record, the Aedes aegypti is the most efficient. It's more efficient vector than Aedes aegypti because it's the lifespan of Aedes aegypti can live longer, so it's more efficient when transmitting the disease. And in this record, we tried to identify the cases, and most of cases happen in Kaohsiung City. That's why I choose Kaohsiung City as an example to construct the time series prediction model. And this is our cases of dengue fever in Kaohsiung. You can see the largest outbreak happened in 1988 and also 2002 at that time. And dengue fever is also the only one vector-borne disease in Taiwan have vector surveillance system. The health administration people will go to the household to collect the water content to count the mosquito lavage in the water content in the household. So they can produce the vector density. So there is vector density data and surveillance since the 1996. And in the first beginning, I analyzed this data. I was thinking the vector density should be the good indicator to predict the disease. But as you see, in the 1992, the biggest outbreak in recent years, the increase of the cases is reverse associated with the vector density. Because the vector density is also an indicator for policy intervention program. It's a KPI for intervention for CDC. So they like the cleaning process or spread of disease, insect spray, insecticides. In my many cases, I cannot see the association. That's why I try to see, because there's human intervention in this indicator. So the good things is weather parameters. We don't have human intervention. So I try to establish the relationship. And using cross correlation coefficient, we can see the most significant association will happen in the time lag at 2 months. It meaning that the 2 months, the weather in 2 months ago is a fact, the occurrence in current months. And this is very important information, because when we look at the time span of the Aedes aegypti, this major mosquito, their lifespan is 30 days, and they from their age to the adult also spend 30 days. So this fit very well under the biological mechanism. And after that, we try to establish a prediction model by using ARIMA and try to integrate some weather parameters, because in this time series model, we try to simplify the covariant factors. We create temperature deviation, which is negatively associated with the maximum temperature and average temperature. And we can see this is the best fit model. We tried many different kinds of model and factors and covariant, and this is best fit model. We see the temperature deviation and relative humidity is negative when you tap into the covariant is associated. And the model fit well in the actual instance and predict instance, and we also forecast the incidence in the future. It also fit well. In this exercise, we note because temperature can affect the artificial water container, because the temperature will get too high, the efficiency effectively evaporate the water contents, because the hatches of those Aedes aegypti is under our house with the water container, so temperature will affect that. And in humidity parameter will also affect, from the literature, it's interesting, it will affect the mosquito seeking host pattern. Okay, so the mechanism fit well, our data can explain some of the biological mechanism in the transmission of disease. And in this exercise, we can see the lack of 2 months could be used on our early warming system if we want to establish forecast early warming system based on the weather forecast, and in making decisions on public health prevention programs such as timing for executing programs on vector controls and environmental intervention and personal protection promotion. This early warning system could be used by predict by weather parameters. And the other second part I want to showing that I try to analyze the temperature, the change of temperature and other weather parameters, and its effect on the dengue fever endemic in Taiwan. And this is the first time I tried to integrate those databases by using geographic information system. And before I joined the TCCIP team, when I'm working on this part, I have to estimate my own grid data for the temperature by using the sampling the monitoring station to interpolate to the raster by clicking, and I use the 1 kilometer cell size. And because the most our disease notification data is in township level, so I need the resolution for me is a township. So I need to do some estimation, zonal estimation, to calculate average temperature within the township polygon to represent the spatial pattern of all my weather parameters. And there are two parameters. One is for temperature and the other is for rainfall. And I estimate by my own, but in this workshop, I know I can get better database from TCCIP platform, and I can let's validate, and I have more confidence that using those data, I can analyze my data set to see the pattern, to reconfirm the pattern. And in dengue fever, this plot is the cumulative incidence rate in Taiwan, and you can see the red, the polygon is the 55 epidemic area we identify with the highest incidence cases. And when we compare the epidemic area and other area, we'll see you will have generally higher temperature and higher rainfall during the summertime. And the other part is when I want to see, because many factors will affect the distribution of disease occurrence, so I use principal component analysis to take into account many socio-economic factors. There are three factors: urbanization, elder population, and also of origin. I take into account the models, and I use spatial regression models, spatial lag models, because the mosquito will, the disease occurrence will affect. They have spatial dependency, so the mosquito will cross the border to infect others. So this model takes into account the spatial dependency, and two factors is dominated in this model. And one is the annual number of months with average temperature higher than 80 degrees, because the mosquito at this age will stop feeding when the temperature lower than 80 degrees Celsius, according to the literature. And also the urbanization, also another key factor in disease pattern. So I use those two factors in classified risk map of Taiwan, and this is using the model and fit very well with the case number distribution. And in this year, TCCIP provided me a statistical downscaling data, and so if this is what we predict in the original model, and in the future we probably will have another the broaden risk area by using the model prediction. Now we are still working on this. Okay, this is the conclusion. I will skip this one. The other cases, I will try to see the impact of heat and cold events and its determinant of the regional vulnerability in Taiwan. In these cases, the cold surge is identified based on the Central Weather Bureau's definition, and the heat event is provided by Professor Lin. He is not in this class right now. His definition is maximum summer temperature higher than 35 degrees for more than 8 hours per day, or maximum temperature higher 35 degrees Celsius more than 8 hours within 3 days in Taipei City. Okay, and we can see that Taiwanese people actually more sensitive to cold events rather than heat events. You can see after the cold event, the cardiovascular mortality significant increase, but after the heat event, it doesn't increase at all without significant difference. And when we see the cardiovascular disease 2 weeks after the cold and heat event, this is cold event, we can see one pattern. Yes, highest mortality occur in rural area, and the lowest, relatively low mortality occur in urban area. So what's the major key factors affect on the distribution of the increase of mortality? I try to see other factors effect when people under the extreme extreme temperature. So the same strategy I use to categorize 4 different kinds of factors, and this is the final model, and take into account the baseline of each township and also the mean temperature of extreme temperature events, the temperature during the event distribution. And also we take into account 4 factor extract of social demographic factor, medical resource and urbanization, susceptible population like elder populations, and also up-origin population is very important in Taiwan, and also lack of economic opportunity. We can see that the baseline dominate the effect, of course, but there are 3 factors will affect the vulnerability when people face temperature events. One is medical resource and urbanization. It's reverse. It's a kind of protection factors. And the other one is susceptible population, like elder living alone, have higher elder population. And if the township have high up-origin population, this township will also have higher vulnerability under the threats of the temperature extremes. This is my conclusion. Our data find the up-origin people and the elders are vulnerable subgroup under the temperature extremes, and social inequality across the urban and rural township might also affect. Climate change will amplify, for public health, will amplify existing hazards. And those population the most at risk, it's very important to identify those population most at risk of adverse effect from climate change to reduce their vulnerability. That's my comments. Actually, I prepare a small slides for data user. Point of view. For public health data, our highest resolution is township. We try to analyze all the data in township level. But so the best spatial resolution for weather parameters should be 1 kilogram. The cell number, the 1 kilometer is the best for township level analysis, because many townships in Taiwan is small island, many townships in Taiwan very small. So if the 5 kilogram meter grid is covered several townships, and I cannot differentiate the difference. So this is the best resolution. And also different disease have different biological mechanisms. So we will need different temporal resolution. The good news is our temporal resolution, the minimum is daily data. So for dengue fever, monthly is okay. For shigellosis, probably we need weekly data. And the definition of temperature extreme, like heat wave in Taiwan, I still very confused about this the definition right now. I know Professor Lin have a new poster outside, and he told me I can use his update heat wave definition for reanalyze my data. But is there have a clear definition of this? And also because for public health people, we don't have so many computer resources to analyze the huge database. So if we can generate some secondary indicator like a job index, heat index for the human health effects, and they will much useful. And we can try at first from these indicators. This is my talk. Thank you.
We can have one or two very quick questions.
Just a very quick comment. So just as just to say that it's very nice to see the slide at the end and requesting what users need. So I think I would just second the comment that it would be useful for meteorologists to produce a range of indicators that lots of people use, thermal comfort or heat waves, cold surges, whatever. If they're defined once and produced, then many social scientists or epidemiologists can use the data. But the other way around as well, I was going to suggest that you're the first person that sort of mentioned social vulnerability and used the population data sets.
Yeah.
It would be interesting to produce some general vulnerability maps of some sort with that census data that different people could also use.
Thank you for your comment.
Any other question? Okay, if there is no more question, then we thank Professor Wu again, and we can have